research, I guess one of the beginning points of research, once you've decided the topic and what you want to research on, it's important to think about what theories are guiding your research. What is the approach you want to take? And this will, your theoretical lens, the theories that inform that you're going to use is going to affect the questions you ask, the methods you use. It's going to affect how you interpret your findings. It's going to affect every aspect of research. So it's important to start with what is your theory about the world? What aspect of the world are you interested in? So a theoretical lens, you might be looking at, you might be interested in women's experiences of maternity. And in that case, you might want to use a feminist theoretical lens to structure your work. You might be interested in how the privatization of hospitals affects patient care, in which case you might want to use a Marxist lens. So here I've suggested, for instance, so I often use a post-colonial lens. My research involves people who are seeking sanctuary in other countries, migrants, refugees, asylum seekers, and mental health. And the theoretical lens I draw on is often post-colonial theory. So this is about looking at the consequences and legacies of colonialism, and it's very useful for me because the idea of a border, the fact that there's global inequalities which force people to flee their lands, the experience of people seeking sanctuary is often it can be exploitative. It can governments often have very racist policies to people who are coming into their countries. So because of all these things, these are all, to me, linked to legacies of colonialism, especially in the UK context, where the UK is saying who can and can't come in. And often the people who are coming from places that they have formerly colonized or invaded. So for me, using a post-colonial theory to shape my research is really helpful. And it's specifically, this is that the UK government is saying who can live and who can die, which to me feels like a very colonial power to have. And so how do I apply this lens in my research? There are many ways. So in terms of maybe whose knowledge do I value as important? So maybe instead of focusing on government policy, I'm focusing on people's experiences and what they say, because to me their stories and their knowledge is more important than what the government says. It might help me think about, once I've done some of my research, got some of my findings. So for instance, I've got a quote here from a Iranian person I interviewed, Iranian person who recently gotten refugee status. And they said British communities, the first label they will assign to a refugee is someone using benefits. They say this person has no use in their community and that they are parasites. But they're talking about how they feel British people talk about them. And I guess if I then bring a post-colonial lens onto this, I can say, well, this idea of using benefits and being a parasite comes from a tradition of calling other cultures and people lazy, right? It comes from this idea of British supremacy, that we are the ones who are efficient and producing things, and the rest of the world are useless and just must be civilized. I don't know. It helps me tease out the ideas underneath what this person has said. So yeah, and I think it helps me compare and contrast with different situations, and it just helps me think better, basically. So a theoretical lens is really useful, and it helps me, the questions I ask people will be shaped by my theoretical lens. in my research, for instance, I try not only to use information and knowledge and data from what people have said, but also to include other forms of knowledge, such as poetry, that can be included in research. And that comes from thinking about post-colonial theory, thinking about what knowledge colonizers dismissed and tried to denigrate and tried to keep away. So there's a very good book, by the way, called Decolonizing Methodologies, if you are interested in how in anti-colonial research methods. That is beyond the scope of today's lecture. So let's get into some. Are there any questions on this, by the way? Because it's quite a in-depth concept. No, in which case I'll go on to different types of data collection. So basically, the types of research you could have are very broadly. You can either do research where you are directly collecting information and data from someone, or you can do research where you are looking at data and information that has already been collected. So it's primary and secondary research. You can either work with numbers, quantitative research, or you can work with words, images, things that can't be quantified, which is qualitative research. And common methods are in-depth interviews for qualitative research. So when you spend time talking to someone, trying to understand their perspective, the interviews might last several hours. You can have group discussions if you're interested in a societal phenomenon. Ethnography is where you observe people as they go about their daily lives often. So it's about understanding the culture and habits that people have. But there's many. There's probably, I don't know, maybe 1,000 different methods, different ways to collect data. And I've given you a paper there where you can go. It has sort of hundreds of different ways to collect qualitative data. And similarly, there are many different quantitative methods. So you could, you could do a survey where you ask people questions we've done, and you can transform those into numbers and analyze those statistically. You can test hypotheses in experimental controlled environments. You can see people's health outcomes, for instance, over a long period of time, and follow that and see how their habits and their social environment changes what health outcomes they have. So there are many quantitative ways you can collect data as well. So this slide is just to say that research methods, research data collection is incredibly varied. There are so many different ways you can go about your research, and the important thing, I guess, is when you're considering how to do research is, can my data answer my question? And that's where your theory comes in as well, because your theory will inform your question and inform what sort of data you think you value and you find important. There's a whole way of doing mixed methods. So sometimes people might do a quantitative study, let's say looking at the association between smoking and your health. Smoking and, I don't know, smoking and how happy you are, for instance, let's say. And they will find quantitatively that there's a strong association. The more you smoke, the less happy you are. But they won't know why or how. So qualitative research might then be used in a mixed method study to say, okay, we see this association, now we want to explain it. Now we want to see, why is smoking making people unhappy? Is it making everyone unhappy? How is it doing it? So some of the mechanisms can be explained that way. Or you might be testing a new health intervention. You might have a mental health program that you do a effectiveness study or evaluation on, and you find that it's really effective, but it's not effective for certain groups of people, and qualitative research can show, okay, why is it not effective for those group of people? So there's different ways that mixed methods can work. You know, you might start with a qualitative study where you want to find out, you know, the mental health experiences of people seeking asylum, and you talk to lots of people, and you see that there's obviously issues with, for instance, post-traumatic stress. But you don't know, you've only spoken to a few people qualitatively. You don't know how widespread that issue is. So maybe then you do a quantitative study to establish the prevalence of PTSD in people seeking asylum, for instance. So mixed methods is very strong because it takes strengths from both branches of research, but obviously it takes longer and has more resources and requires a breadth of expertise, so a broad team. So next slide. So you've got your data, you've collected your data, it's numbers, it's words, it's images, it's art, it's poetry, it's whatever your data is. And then you want to see, okay, well, what do I do with this data? So qualitatively, there are many sorts of analysis you can do, but they generally start with something called coding, where in the image on the right, you can see that you write down what people have said to you, and then you try and summarize that in a few words. And these few words are called codes. And then you bring these codes together, you look at the relationships between them, and then you take from those broad themes which can help answer your research question. So for instance, here the question is, what in this course has helped you the most? And you can see there that they've taken chunks of text from what someone said, and they've coded it with encouraging expression, responding to questions, feeling valued, checking for understanding, all these things. And because of that, they will then take all these codes from multiple interviews, put them together, and try and think about broad themes that answer what in this course helped them most. So maybe one of the broad themes could be openness. The idea of openness from students and the tutors helped people learn. There is also a range of quantitative and analytic methods. So there are simple statistical tests where you can show that the population that received this treatment and the population that received the placebo, they were different. Their health outcomes were different. Or you can do a regression analysis where you have a lot of different factors that you think are associated with a health outcome. So maybe their health outcome is dementia, and there's education, social contact time, married or not, I don't know, and loads of different factors that you think might be gender, I don't know, could be associated with dementia, and then the regression analysis will tell you how much each factor influences the likelihood of someone getting dementia. So there are, again, lots of different types of data you can collect, and lots of different types of ways that data can be analyzed. And how you analyze that data depends on your theoretical lens. It depends on your question. It depends on, how in depth you need your answer to be, how robust you need it to be. What is it relationships, risk factors that you're interested in? Is it prevalence? Is it do you want to understand why something happens? So yeah, this again is a very introductory slide into all the different types of ways that you can analyze your data.